Hi everyone, this is Grace Song here with Julia Bellet and Farwa Zaidi. This video will be all about 3D printing and bioprinting in the healthcare field. A lot of researchers and patients are taking a new interest in bioprinting tools, prosthetics, and even internal organs. With the overall advancement of technology, 3D printing is slowly revolutionizing medicine by providing more varied, yet accurate and cost-efficient alternatives to current tools and practices that are in use today. The first half of this video will explain what bioprinting is and give some case studies of how it's been implemented. The second half of this video will describe additional ways that 3D printing has been implemented in the healthcare system so far. Now, I'm going to turn it over to Farwa to tell you more about how bioprinting works.
Thanks, Grace. Rather than printing with plastic or metal, bioprinters use a computer-guided pipette to layer living cells, referred to as bioink, on top of one another to create artificial living tissue in a laboratory. 3D bioprinting is used for creating artificial organs, for pharmaceutical testing, for plastic surgery, including skin grafts, and for bone tissue regeneration. The way it works is that scientists begin with a CT or MRI scan to obtain the dimensions of the tissue being created. This is essential because the imaging needs to create a perfect fit for the patient with little to no adjustments. Then they create a 3D model blueprint that includes specific instructions layer by layer. At this stage is where more precise adjustments can be made before the changes are finalized. Then comes the preparation of the bioink. Bioink consists of living cells paired with a base, like collagen or gelatin. The ink is prepared differently based on the procedure and the patient. It is then printed as a fluid layer by layer, where each layer is 0.5 millimeter thin. The layers slowly solidified, aided by UV lights or other heat sources.
The first example that we'll be looking at is a bioprinted human heart. Cardiovascular disease is the world's leading cause of death. For patients in dire need, heart transplants are often the only option available. But the number of heart donors is limited, and too many patients die while on the waiting list. But what if hospitals could simply print out a new heart? That is what the researchers at the University of Tel Aviv are working on. Earlier this year, they announced that they successfully used a 3D printer to create a working human heart made of cells from a donor, complete with human tissue and blood vessels. There are a few limitations to this, however. The first of which is that the heart, as seen in the picture, is only the size of a rabbit's heart. Additionally, the heart does not yet pump blood the way a real heart does, but the cells can contract. This is certainly promising for future study. Researchers said their next steps will be to transplant a 3D printed heart into an animal model. Their aim is for this to happen sometime in the next year.
3D bioprinting can be very delicate and precise work, but has also proved itself to be durable enough for external use. Going off of that, not only have researchers been working on 3D printing internal organs, but have been working on external body parts as well, such as fingers and feet. But for this video, we're going to focus on the 3D printing process of the ear. There's an ongoing research study that has been experimenting with 3D ear printing for children with unilateral microtia, which is a congenital deformity in which a child's ear is underdeveloped. In this process, researchers have replicated the child's existing ears and created a reflected 3D printed model. This replication has been deemed as more reliable and safer as it's made out of the child's own cells. Thus, there will be a lower chance of the child's body rejecting the new body part. However, since 3D printing is a relatively new science, these children are required to be monitored for over 2 years. And as you can see in the photo, it is a very long-winded and technical experiment.
As I mentioned before, 3D bioprinting can be used as opposed to conventional skin grafts. Researchers at the University of Toronto have created a handheld 3D bioprinter to apply layers of skin tissue directly onto patients' wounds that occur due to burns, injury, or other medical conditions. Unlike traditional skin grafts, this device does not involve removing healthy skin from one area of the body and transferring it to the wounded area. The device is small, weighing less than 2 pounds. It rolls out the layer of skin tissue created through bioink like tape over the affected area. It applies directly over the skin in under 2 minutes. This saves patients time and greatly minimizes their pain. However, this device has yet to have been tested on humans. As of now, it has been successfully operated on pig skin. Now we will transition to look at 2 other applications of 3D printing in healthcare, the first of which is 3D surgical models.
So as Farwell was saying, we will now be looking at how 3D printed surgical models can be used to help surgeons prepare to perform complicated surgeries. For example, in Dubai, doctors successfully operated on a patient who had suffered a cerebral aneurysm in 4 veins. This is an exceedingly complicated surgery. A 3D printing company was contracted to make a model of the aneurysms, which is the image that you are looking at now. Surgeons were then able to map out how to safely navigate the blood vessels and were able to save the patient's life. This technique has been proven to speed up procedures and minimize trauma for patients. Additionally, it has been performed successfully in surgeries ranging from a full face transplant to spinal cord procedures, and is beginning to become routine practice.
Along with tools for surgery, 3D printing has expanded into the prosthetic industry. Every day, people lose body parts due to underlying diseases, trauma accidents, or even previous injuries. In most cases, amputees opt to get fitted for custom prosthetics for their missing limbs. But these prosthetics can range from $1,000 to even $10,000. And for children who are in the process of growing, changing and refitting a prosthetic every other month is a costly commitment. 3D printing prosthetics is a developing science that is focused on maximizing comfort, usability, and cost efficiency, but it's come a long way. 3D printed prosthetics are most useful for patients who enjoy seeing colorful designs, children who are constantly outgrowing or damaging their prosthetics during playtime, and patients who are unable to afford the standard pricey prosthetics. With 3D printing integrated into the art prosthesis, the options regarding colors, designs, and materials are endless. 3D printing can and will revolutionize the way we handle and see amputees.
Like the three of us have discussed in this video, the benefits to using 3D bioprinting are endless, and this advancement in technology is revolutionizing the medical field by generating all kinds of treatment and recovery options for patients with various conditions. As we wrap up, here are some discussion questions to think about. Are there any ethical concerns with bioprinting organs, specifically when it comes to testing on humans? And also, how could 3D bioprinting lead to a disparity in healthcare and access to this technology?